When the medical helicopter's engine failed over Lake Michigan with a critical patient aboard, flight nurse Maria Santos faced the most challenging scenario of her civilian career. She had 10 minutes before they hit the water, a dying patient who needed continuous medical intervention, and aviation emergency knowledge that could save everyone. But revealing her military background would mean admitting to helicopter crash survival skills she'd spent 4 years trying to forget. The Sikorsky S-76 medical helicopter was shaking violently as warning alarms screamed through the cockpit. Pilot Jake Morrison was fighting to maintain control, while co-pilot Lisa Chen was radioing emergency services. In the back, Maria was keeping 8-year-old Tommy Rodriguez alive after a near-drowning accident that had already stopped his heart twice. Engine failure! Engine failure! Preparing for emergency water landing," Jake shouted over the alarms. Maria's Army Black Hawk training kicked in instantly. Aircraft emergency assessment, patient medical stability, crash survival preparation. But she was wearing civilian flight nurse scrubs instead of combat gear, treating a child instead of wounded soldiers, and facing a Lake Michigan water crash that would kill everyone if handled like civilian emergency procedures. Welcome to Secret Human Stories. Before I tell you this incredible story of hidden military aviation expertise that prevented a medical helicopter disaster, tell me in the comments what city and country you're watching from. And if you want to see more stories about heroes hiding in plain sight, hit that subscribe button right now. Because sometimes the most skilled combat flight medics are saving lives in civilian air ambulances, waiting for the moment when their battlefield training can protect innocent people when everything goes wrong at 2,000 feet. 3:47 p.m., 20 miles east of Chicago over Lake Michigan. Flight for Life helicopter N847ML was transporting Tommy Rodriguez from a Wisconsin lakeside hospital to Children's Memorial Hospital in Chicago after the boy had nearly drowned in a boating accident. Tommy was in critical condition, hypothermia, cardiac arrest, severe brain swelling, and needed specialized pediatric intensive care that only Chicago could provide. Maria Santos had been working as a civilian flight nurse for 4 years, and she'd handled hundreds of critical patient transports. But she'd never faced a situation that combined her two greatest areas of expertise, military helicopter survival and pediatric critical care medicine. The engine failure had occurred at the worst possible moment, over open water, with weather conditions deteriorating, and a patient whose survival depended on continuous medical intervention that couldn't be interrupted even during an aviation emergency. Tommy's condition was so critical that stopping his medical treatment for even 30 seconds could cause irreversible brain damage or cardiac arrest. Staff Sergeant Maria Santos had served 10 years with the Army's 159th Medical Company Air Ambulance, specializing in helicopter medical evacuations from combat zones in Iraq and Afghanistan from 2010 to 2020. For 10 years, she'd been a flight medic whose mission was providing advanced trauma care while flying in Black Hawk helicopters through the most dangerous airspace in modern warfare. Her military record included 267 successful medical evacuations, 89 helicopter emergency landings, 23 aircraft crashes survived, and a reputation among Army aviators as someone who could keep patients alive during helicopter operations that challenged the limits of military aviation and combat medicine. But Maria's specialty hadn't been routine medical transport. It had been what Army flight medics call hostile environment medical aviation, providing critical care while flying through enemy fire, treating wounded soldiers during helicopter mechanical failures, and maintaining patient stability during emergency landings in combat zones. Now, 4 years after leaving the Army, Maria was facing a situation that required every skill she'd learned during a decade of military medical aviation: emergency helicopter survival, critical patient care under extreme conditions, and the leadership necessary to coordinate civilian crew members who had no experience with aircraft emergencies over water. "Maria, what's Tommy's status?" Jake called from the cockpit as he struggled to control the failing helicopter. Patient is critical but stable. I can maintain life support during emergency procedures. Maria's voice carried the kind of calm authority that immediately told Jake this wasn't her first helicopter emergency. But here's what made this medical helicopter crisis even more impossible. Tommy Rodriguez wasn't just any patient. He was the son of Colonel Diego Rodriguez, Maria's former commanding officer during her deployment in Afghanistan, and the little boy she'd helped deliver during a forward operating base medical emergency 8 years earlier. Maria hadn't seen Diego or his family since leaving the Army, but she recognized Tommy immediately from the photos Diego had shown her during their deployment. The child whose life she was trying to save was the baby she'd helped bring into the world in a combat zone, and now she was the only person who could keep him alive during a helicopter crash that civilian training couldn't handle. "Jake, I need you to listen carefully," Maria said, moving into full military flight medic mode. "I'm Staff Sergeant Maria Santos, Army Medical Corps, retired. I specialize in helicopter medical operations and emergency aviation survival. I'm going to coordinate this emergency landing while maintaining patient life support on a critical pediatric patient." Jake Morrison had been flying medical helicopters for 12 years, but he'd never heard the kind of aviation expertise that Maria was displaying. "Maria, what are you talking about?" "Pilot, I've survived 23 helicopter crashes in combat zones and conducted 267 medical evacuations under hostile conditions. This engine failure is manageable if we follow proper emergency procedures, but we need to coordinate our approach to minimize impact forces while I maintain continuous medical intervention on a critical pediatric patient." Maria began implementing emergency procedures that combined her Army aviation medical training with her knowledge of civilian medical equipment and pediatric intensive care medicine. She had to function as both combat flight medic and critical care nurse while coordinating with civilian aircrew who had no experience with water crash landings. The helicopter was losing altitude at 300 feet per minute, which gave them approximately 8 minutes before water impact. Tommy's medical condition required continuous monitoring and intervention. His heart could stop again at any moment, his brain swelling needed constant medication adjustments, and his hypothermia treatment couldn't be interrupted without causing fatal complications. Staff Sergeant Maria Santos secured Tommy's medical equipment using techniques learned during Army helicopter operations where medical devices had to function during aircraft emergencies, enemy fire, and crash landings that would destroy normal civilian medical setups. "Missa, I need you to prepare emergency flotation systems and survival equipment," Maria instructed the co-pilot. "Jake, establish glide approach at minimum descent rate. We need maximum time for medical stabilization before water impact." Maria's military training was taking over the civilian medical evacuation, converting their emergency into a coordinated survival operation that utilized both aviation expertise and combat medical knowledge. But here's what Maria couldn't have anticipated. The engine failure hadn't been mechanical. It had been caused by enemy action that she would recognize from her combat experience in Afghanistan. Through the helicopter window, Maria spotted something that made her blood run cold. A small boat positioned directly beneath their flight path, with equipment that looked suspiciously like the portable surface-to-air missile systems she'd encountered during military operations. The engine failure hadn't been an accident. It had been an attack designed to bring down the medical helicopter, and the people responsible were positioned to finish what they'd started when the aircraft hit the water. If you're already on the edge of your seat, make sure to hit that subscribe button because this story is about to become a fight for survival. Maria's combat experience told her they were dealing with a planned attack on the medical helicopter, possibly targeting Tommy Rodriguez specifically because of his father's military position. Colonel Diego Rodriguez had been involved in classified operations that would make him and his family targets for retaliation. "Colonel, we're not dealing with mechanical failure. We're under attack," Maria informed the pilot, while continuing Tommy's medical treatment. "Change course immediately and prepare for hostile action during emergency landing." Jake Morrison looked at Maria with confusion and disbelief. "Maria, what are you talking about? This is a medical emergency, not a military operation." "Pilot, I'm observing coordinated positioning of hostile vessels equipped with weapon systems consistent with anti-aircraft capabilities. This helicopter has been targeted, and we need to implement evasive maneuvers while preparing for combat survival under hostile conditions. Maria was simultaneously treating Tommy's critical medical condition while providing tactical intelligence that could save their lives. Her Army training had taught her to recognize enemy action patterns, and everything about their situation indicated they were facing a coordinated attack rather than random mechanical failure. The boat below was moving to intercept their projected crash site, and Maria could see additional vessels positioning themselves to prevent rescue operations. This was a planned operation designed to eliminate Tommy Rodriguez and anyone else aboard the helicopter. But Maria had survived situations like this before, helicopter crashes in hostile territory where enemy forces were waiting to kill survivors. Her Army training had prepared her for exactly this scenario, but now she was protecting a child and civilian aircrew instead of fellow soldiers. Maria activated emergency protocols she hadn't used since Afghanistan. Jake, execute immediate course change to heading 270, minimum altitude descent. Prepare for hostile water survival operations under hostile conditions. Lisa, monitor radio frequencies for enemy communications and prepare emergency medical equipment for water survival. I'm implementing combat medical protocols for extended survival scenario. Maria was converting their civilian medical helicopter into a military survival operation, using her Army aviation medical expertise to prepare for helicopter crash survival while maintaining life-saving medical treatment for Tommy Rodriguez. The emergency landing had to be perfect, close enough to shore for rescue operations, but far enough from the hostile vessels to prevent immediate capture or elimination. Maria's tactical knowledge of helicopter water landings would determine whether they survived the crash and the enemy action that would follow. Tommy's medical condition was deteriorating as the stress of the emergency affected his critical systems. Maria had to balance his medical needs with survival preparations, providing pediatric intensive care while preparing for combat survival in Lake Michigan. "Tommy, stay with me, buddy," Maria whispered to the unconscious child while adjusting his medical equipment for water impact. "Your dad would be proud of how brave you're being." Maria secured Tommy's medical devices using waterproof military techniques, prepared emergency medical supplies for survival conditions, and briefed Jake and Lisa on post-crash survival procedures based on her Army experience with helicopter emergencies in hostile territory. The water impact was violent but controlled. Jake's piloting skills combined with Maria's military aviation knowledge resulted in a survivable crash that kept the helicopter intact long enough for emergency evacuation procedures. But as soon as they hit the water, the hostile boats began closing in for what was clearly a planned elimination operation targeting Tommy Rodriguez and any witnesses to the attack on the medical helicopter. Maria faced a decision that would determine whether Tommy survived his medical crisis and the combat situation that was developing around their crash site, maintain her civilian identity and hope for conventional rescue, or reveal her military capabilities and fight to protect the child she'd helped deliver during a combat deployment 8 years earlier. Maria chose to fight. Using emergency equipment from the helicopter, her knowledge of water survival, and tactical skills learned during Army combat operations, Maria prepared to defend Tommy Rodriguez and the civilian aircrew against the enemy forces that had shot down their helicopter. The battle in Lake Michigan would test every skill Maria had learned during 10 years of military service: medical expertise, combat training, survival knowledge, and the determination to protect innocent lives when conventional help wasn't available. Using improvised weapons from helicopter emergency equipment, Maria engaged the hostile boats while maintaining Tommy's medical treatment and coordinating the survival of Jake and Lisa. Her Army combat training provided tactical advantages that the attacking forces hadn't expected from a civilian medical helicopter crew. The engagement lasted 47 minutes. Maria used military small unit tactics to defeat superior numbers while simultaneously providing life-saving medical care to Tommy, whose condition remained critical throughout the combat operation. 3 hours later, Coast Guard rescue teams found Maria, Tommy, Jake, and Lisa alive on a life raft 12 miles from the crash site. Tommy's medical condition had been stabilized using improvised equipment, and the hostile forces had been neutralized using techniques that clearly indicated someone with advanced military training had been responsible for their survival. The investigation revealed that Tommy Rodriguez had been targeted because of his father's involvement in classified military operations that had disrupted terrorist networks. The helicopter attack had been planned by foreign agents seeking revenge against Colonel Rodriguez through his family. Maria's dual expertise in military aviation medicine and combat operations prevented not just a medical emergency, but had thwarted a terrorist assassination of a military dependent. FBI Counterterrorism Director James Wilson later described Maria's response. Staff Sergeant Santos's combination of medical expertise and combat training prevented what would have been a successful terrorist assassination of a military dependent. Her ability to maintain life-saving medical care while conducting defensive operations exceeded anything we've seen in civilian emergency response. 6 months later, Maria received a visit from Colonel Diego Rodriguez, who had flown from Afghanistan to personally thank the woman who had saved his son's life twice, once at birth in a combat zone and once during a terrorist attack over Lake Michigan. "Maria, you've been Tommy's guardian angel since the day he was born. I can never repay you for what you've done for my family." Maria's response reflected her understanding of how military service continued in civilian life. "Sir, protecting Tommy wasn't about repaying old debts. It was about using the skills you taught me to serve the mission of protecting innocent life, whether in combat zones or civilian emergencies." Tommy Rodriguez made a full recovery and grew up knowing that the woman who'd saved his life twice had been his guardian angel in both military and civilian life. He later joined the Army Medical Corps, inspired by Maria's example of service that transcended uniform changes. Today, Maria Santos works as chief flight nurse for Chicago's Emergency Medical Services, where her Army aviation medical background provides expertise that saves lives during the most challenging helicopter medical operations in civilian emergency medicine. Her colleagues know about her military background and appreciate having someone whose combat aviation experience provides medical capabilities that conventional flight nursing cannot match during the most dangerous emergency medical operations. If this story amazed you, make sure you're subscribed because we have more incredible military heroes protecting civilian communities. Maria's story demonstrates that military aviation medical training creates lifelong protectors who carry their life-saving expertise into civilian communities, ready to use both their medical knowledge and combat skills when emergencies threaten innocent people, who depend on their expertise for survival at 2,000 feet or at sea level. American patients receiving medical helicopter transport can fly with confidence knowing that warriors like Maria Santos have traded their military flight gear for civilian medical equipment, but never surrendered their commitment to saving lives when aviation emergencies require expertise that only combat experience can provide.